Happy Friday, everyone. This is Nurse Eunice, and yes, I have missed you. So, welcome to Friday Night Live. We have another CNA and PCT review, and as we do in each of our videos, we're going to give you a few moments to receive your notifications. And I already see Sophia in the comments. So, hi, Sophia. And I know a lot of you all want to do more than just CNA. So, if you're interested in online medical assistant training, that includes MA, phlebotomy, and EKG all in one, I have an option for you. I want you to go to floridacareeracademy.com. Yes, that is floridacareeracademy.com. We've partnered with Career Step, and in this partnership, we're able to offer hybrid courses. And so your coursework is done online at your own pace, and then your clinicals, your hands on training, is done at an office, whether it's Fresenius, a dialysis clinic, a hospital, it's going to be done in your area. And so, for you to speak to one of our advisors, you can either call the number listed on the screen or you can go to floridacareeracademy.com to learn more. And so many of you have already, you've been so gracious. You've been purchasing our $7 vital sign bundles. My team and I, we work tirelessly in order to, create these videos, create the presentations and the slides. And so the way that you can help us is just take your cell phone, open up your camera app, and scan the QR code that's on the screen. You'll see a plethora, you'll see a lot of free products and different study guides, but then you'll also see our vital sign study guide for $7. And that's the way that you can help us as we keep pushing out these videos. We know the economy is changing, so any assistance you can provide to help me bless my staff, I appreciate it. And that's it, you all. Let's go ahead and get started with our questions. I'm I saw Sophia earlier. Looks like we have Natasha, we have Mevra, and also Kristen and Farah. Hey, everybody. All right, so question number one. A resident with pneumonia might show which of the following symptoms? Is it A, increased energy, B, coughing with blood tinged sputum, C, swollen legs, or D, coughing with greenish sputum? And everybody, I see you as you come in. So, hello, let's do this practice test. I think we have 40 questions. All right, go ahead and put your answers in the chat. And I see a D. We're torn between D's and B's. So we know that a person with pneumonia, they'll have a cough. But what is the normal color for the sputum if someone has an infection? That is the key term, the infection. They have pneumonia. So everybody who's putting B in the comments, blood tinge is usually not pneumonia. It's going to be the greenish tinge. So the answer is going to be D. So pneumonia often presents with symptoms such as coughing with colored sputum, fever, and difficulty breathing. So great job. If you didn't know that, now you know. And regardless if someone has abnormal colored sputum, you're going to go ahead and try to keep a sample for your nurse, but you're going to make your nurse aware. Question two. A walker may be used if the client can. Would it be A, support some weight, B, use her hands well, C, balance without help, or D, walk independently? And is it, hey, I'm so proud of you. I watched your video Sunday night and I passed my knowledge test. You are so welcome. Congratulations. All right, let's see what we have for question number two, team. Oh, we're everywhere. We have A's, B's, and C's. We even have a D. So, what is it, team? When someone has a walker, what can they do? That's right. And Neil, it is A. They can support some of their weight. So, here's our rationale. A walker is used by individuals who need assistance with balance and support. If the patient can support some weight, they are likely to be able to use a walker to provide stability while walking. Those who are unable to support weight may require a different type of assistive device, such as a wheelchair. So great job, team. I'm so proud of you. Question 3, are y'all ready? A cane should be used on, would it be A, the affected weak side of the body, B, the side with the strongest leg, C, the unaffected strong side of the body, or D, the weak side one day and the strong side the next day? I know this one's a little tricky. All right, I see some C's, I see some B's, but looks like the C's have it. And so the reason that it is not B is just because someone has strength in a leg, they could have their arm could be, partially amputated. It could have been burned. It could have surgery. So it's not about the strongest leg. Whenever someone's using a cane, a handheld device, we need them to use it on the unaffected side of their body. So the strongest side of their body, including their arm, not just their leg, because they're using their arm to support the rest of their body. So the answer to 3 is going to be C. So a cane should be used on the unaffected side, the strong side of the body. This provides support while allowing the patient to maintain balance and reduce strain on the weaker side. So give yourself grace. I see you, Joyce. Yep, that's true. Question number 4. A patient is holding their abdomen and complaining of severe pain after eating. Which condition might this indicate? Would it be A, a urinary tract infection? I like the answer so much, I put it twice. B, a urinary tract infection. C, a migraine. Or D, a gastric ulcer. And as a CNA, you don't diagnose, but you have to know when to let the nurse know if something's wrong. And so you wouldn't go up and say, hey, I think the patient has a migraine or a gastric ulcer, but you'd say they're complaining of severe pain rating an 8 on a scale of 0 to 10, but the pain didn't happen until after she ate. And so, yes, if you chose D, gastric ulcer, give yourself applause. Gastric ulcers can cause abdominal pain that worsens after eating, which is why another reason we just don't let them lay back immediately after they've eaten a meal. We have to get their food time to digest. And so otherwise those acids can back up and it can actually irritate that ulcer even more. All right, question number 5. When applying a cold treatment to a patient, it is important to observe the patient closely for signs of A, redness, B, dizziness, C, fainting, or D, cyanosis. Yo, Claudia, I'm so proud of you. Congratulations. Passed both exams. That's going to be the story for a lot of you all. All right, so for question 5, I see A's and I see D's. And so whenever we apply a cold compress to somebody, remember some of our older patients, their skin is very sensitive. And so while it might turn red if it was maybe a warm treatment, usually when something is cold, it's going to become mottled or it's going to become cyanotic. So yes, it is D, but I'm so proud of you all. You were torn between A's and D's, but D would be the answer. So when cold treatments are applied, it is crucial to monitor for signs of skin damage, including cyanosis. Here it says bluish, but it's like a discoloration. On brown skin people, it can be purplish. Whenever you see that, that could indicate poor circulation or tissue damage due to the prolonged exposure to the cold. So when we say cold compress for 10 minutes, don't let that cold compress stay on for 30 minutes because if that patient's unable to verbalize that this doesn't feel good, you can actually cause injury to them. Question number, let's see what number this is, number 6. The purpose of correctly positioning the client is it A, to prevent skin breakdown, B, maintain function of joints and muscles, C, increase comfort, or D, all of the above? And this one was an easy one. I have to give you an easy one every now and then. So looks like Gerald has it. Let's see if anyone else has it. Oh yeah, we have a lot of people. Kristen, we have Elizabeth. So great job. Trying to see if I can get the comments on the screen better. All right, let's go to our next one. Question number 6. The answer was D. You all were aware. Great job. Question number 7. A patient is having difficulty breathing. What position should the CNA assist them into? Would it be A, supine, B, prone, C, Fowler's position, or D, side lying position? All right, Rachel, Emilia, Farah, Qualzum. Yes, it is C, but that would be too easy just for you to be able to tell me C. I want you to tell me whenever we have someone in a supine position, what does that mean? Put it in the chat. What does supine mean? What does prone mean? And when we put someone in the sideline position, so I need 3 different responses. And no, you don't have to answer every response as an individual, but as a team, I want to know what the supine position means. What does it mean to put someone prone? And when would we put someone in the sideline position? Give me a few answers. All right, so Heidi says that supine is flat. Yes, girl, you got that. So Heidi's right. Someone else, give me a response. So Elizabeth Close, supine, they're on their spine. So supine means they're flat. Let's see, let's see. I'm still waiting for prone. What does prone mean? Heidi's been studying. Heidi says prone is on the stomach. So you all, and yes, Claudia, Fowler's is 90 degrees. They have a couple of Fowlers. They have semi and they have high. So it can go anywhere from 45 to 90 degrees, depending on the patient's needs. And now I need to know, why would we put someone in the sideline position besides repositioning them? Like, what would be a medical reason to put someone in the sideline position? All right, try to give you about 10 seconds for you to answer that one for me. And I have missed studying with you all, so I hope you're having a great week. All right, I'm going to give you the answer if I don't see it in 5, 4, 3, 2, and all right, seizures. So yeah, so anytime you think someone's at risk of aspiration, so they've been seizing and now you may have some foam or some type of secretions, they're unable to clear their airway, you return them to the side. Another reason that you put someone in the sideline position is if they're unconscious and you have to perform oral care, you're not going to sit them upright because they don't have a gag reflex. So the fluid, even a small amount, can go into their airway. So instead, you turn them to their side, and any excessive secretions would just pool in the cheek area. So sideline position would also be if you're helping the nurse. Remember, you don't give medications, but if I tell you that a patient needs an enema, you'll be putting them in the Sims position, which is a sideline position. All right, so great job. Question number 8. The preferred way to remove a bedpan from a client who is unable to lift her buttocks is to A, use a mechanical lifting device, B, turn the client to the side while holding the pan, C, slowly slide the pan from under the client, or D, have another nursing assistant lift the client. And then Joyce and Mulang, I see your answers. You're absolutely right. All right. So, what's the preferred way to move a bedpan from a client who is unable to lift the buttocks? We're torn between, looks like C's and D's. So, when you're taking your test, remember it's about what you should be doing or what you can do. And so, guess what? You can do by yourself. Make sure I have the right one there. So this one's going to be B. I do see some B's there. So let's talk about the differences. C says slowly slide the pan from under the client. If their body weight is on top of that bedpan, it's going to be hard for you to slide that bedpan without shearing or tearing their skin. So the answer isn't C. And then D, that's just the easy way out. I'm going to call another nursing assistant who has her 20 patients to come over and help me, but I want you to do B. I want you to see if you can turn that resident off of the bedpan. And so when a client is unable to lift their buttocks, turning the client to the side while carefully removing the bedpan ensures comfort and it prevents injury. We're not tearing their skin. This method is safer than sliding the bedpan from underneath or using another person to lift the patient. Remember, we have to worry about body mechanics and we don't want our partners hurting their backs. And so, if you don't know what I'm talking about, I have a full video library for you. And so, if you scan the QR code that's on the screen, you can see all the CNA videos that are pertinent for most state CNA examinations. And yes, I have one on the easy way to remove a bedpan and the hard way, which would be the turning technique. But I need you to practice them both because the way that you place and or remove a bedpan is not about your preference. It's about your patient's abilities. All right, so let's go to number 9. After shaving a patient with a safety razor, the nurse aide should do which of the following? A, cover it before discarding it in the trash. B, wrap it in a paper towel and drop it in the trash can. C, dispose of it in the sharps container. Or D, place it in the patient's drawer for reuse. I see all the correct answers. That's right. Look, we can't just leave razors around because our patient's going to go in that bathroom and try to shave themselves. So the answer is not D. It is going to be C. When you're done, even if in the normal household setting you could reuse a razor, in the hospital setting, nursing home setting, you're going to discard of it. So using a safety razor, it should be disposed of in the sharps container to prevent injury and to ensure proper disposal of potentially hazardous objects. This prevents accidental cuts or needle stick injuries. And remember, if you leave it in there and the resident sees it, they may try to shave themselves without your assistance, and that's when injuries could occur. Question 10. A patient with Alzheimer's disease becomes agitated in the evening. What is this called? Is it A, sundowning, B, late night confusion syndrome, C, morning fatigue, or D, evening anxiety? So many great responses. That's right. I'm going to give about 5 more of you all an opportunity to respond. All right. Revealing the answer in 3, 2, and yes, it is A. That may be a new term for some of you all, but sundowning refers to increased confusion and agitation in the evening time. So, how will that present itself? Your patient is coherent, they're able to answer questions and participate in their care more during daylight hours. But as it gets darker, they're starting to get confused. They want to know why you're in their house, and you're like, Miss Lucas, this isn't your house. This is ABC's nursing home. And so, but you're going to see a trend. You're going to see that happen to a lot of your patients, especially when they're in an unfamiliar environment. They get confused at night. So if you're concerned about it, that's something that you can talk to your nurse about. Question number 11. A patient with jaundice will have which physical sign? A, yellowing of the skin and eyes. B, darkening of the skin and eyes. C, pale skin. D, bluish lips. Great job, great job, great job. Everybody got this right. 100% team. It is A. Jaundice is characterized by yellowing of the skin and eyes, often due to liver dysfunction and diseases such as hepatitis. Question 12. Upon entering the room, the nurse aide notices that a patient is not breathing. The aide's first action is to A, start chest compressions, B, lay the patient down on his back, C, give 4 quick breaths, D, call for help. You enter the room, the patient's not breathing. What do you do? What do you do? What do you do? All right, I see the correct responses. It's gonna be D. I need for you to get help in that room. I know you want to start your chest compressions, but the patient could be a DNR. So you need to call for help. Get that nurse, get that whole team in the room because you only check for breathing. You didn't check in this particular instance to see if they had a pulse. So if a patient is not breathing, the first step is to call for help to get the emergency medical team, get your nurse in that room. This includes activating the button. There's usually going to be a panic button in your room. Whether you press it or if you're in the bathroom, you pull the emergency cord. After calling for help, the aide can then proceed to CPR if trained and instructed to do so. Because remember, you have to know your patient's code statuses, and not every patient is going to be a full code, meaning that they're going to require CPR in the event that their heart should stop or they stop breathing. So your priority is, once you recognize it, your priority is to get the team, get your nurse into the room right away. Question 13. A patient is on bed rest. A patient on bed rest, I can't even speak today. A patient is on bed rest wearing anti-embolytic stockings. How often should the stockings be removed? A, never. B, Q2H. C, at least twice a day. D, Q6H. And I'm so proud of you all. We have dozens of you all who are studying with us on a Friday night. I am so proud of you. So thank you. I know this was a last minute video, but I've been trying to shoot this video since 9:30 this morning. So uh, a true medical professional. Look, we get things done. I said I was going to shoot it, so I am here. All right. So I see a lot of you all putting B's and D's in the chat. What does that mean? What does B mean? Q2H. What does D mean? Q6H. Let's see if you know your medical abbreviations. Let's see if you know them. What does Q stand for? What does 2 and then H? When you put that together, it means something. What does it mean? Now, I'll make sure the first person that puts it in the chat will give you a shout out really fast. Let's see. Oh, I mean, all of you all came back to back. So every 2 hours, every 2 hours. So, yes, Q2H is every 2 hours. If it was every hour, it would be QH. And then we have here, Claudia says for D, Q6H is every 6 hours. So remember, Q is every, then the number, and then H will be hour. If there's no number there, that means we're doing it every hour. So your answer, everybody, even though I know that you never see this happening in the real world, is you're supposed to take someone's stockings off every 2 hours. Why? Because you're supposed to be assessing their skin and massaging their leg, lotioning up, promoting circulation. Remember, I just need you to pass the test. You probably don't have enough time in the real world to do all this, but keeping the stockings on for too long can lead to skin breakdown or discomfort, and it is necessary to check the skin for redness or irritation. We know the stockings are really tight, and then their legs swell, especially when they sit up. It can leave a big indentation, so do check their skin. And I did have a comment up here. All right, so hey Eunice. So it says, hi Nurse Eunice. I want to say thank you because I follow you to learn, and I got my license in October. Congratulations, namesake. I'm proud of you also. All right, let's go to our next one, team. Question 14. Pressure ulcers or decubitus ulcers can be prevented by doing which of the following? A, changing the client's position every 2 hours. B, placing a gel or foam pad on top of the mattress. C, increasing the client's consumption of vitamin C. Or D, both A and B. Congratulations. I mean, I'm so Melaine. I think it's Melanie. I may be pronouncing it incorrectly, but I'm so proud of you all. So many of you all passed your test. Next stop, nursing school is coming. CNA, and then from there, whatever direction you want to go. All right, and so for question 14, yes, the answer is D. You have it. So pressure ulcers can be prevented by repositioning the patient every 2 hours and by using specialized padding, such as gel or foam pads to reduce pressure from the mattress. While vitamin C is important for skin health, proper repositioning and cushioning are more directly related to prevention. 15. The first step in getting the client up to walk is to A, sit the client on the side of the bed. B, put the client's slippers on. C, check the activity order. Or D, tell the client that he will be getting up. What is the first step? And I need everyone to get this answer right. It is so important. We're torn between C's and looks like C's and D's. We have a D. All right, waiting for a few more responses, and I'll show you the correct response. So remember that a CNA doesn't act independently. So before you get someone up, you need to first make sure they have an order to get out of bed. So the answer is going to be C. Great job for those who chose C. So before assisting a client to walk, it is essential to verify the order provided by the healthcare provider. This ensures that the client is medically cleared to engage in ambulation and prevents potential harm if there are restrictions on movement. Skipping this step could result in injury or complications if the client is not permitted to walk. So just like they'll have a diet order and a code status, whenever you look at your physician's orders or the plan of care, it's also going to have an activity status. And then most of the time it's literally going to say out of bed to chair or out of bed with assistance. But if they're post-op, it can say complete bed rest because if they stand up, they can still be sedated, they can fall and cause injury to themselves. So make sure you check the orders first. 16. A client's vital signs are as follows: BP 118 over 80, respiratory rate 10, temperature 98.8, pulse 80. Which finding should be reported at once? Would it be A, respiration, B, temperature, C, pulse, or D, blood pressure? Yeah, so you have to know your vital signs because you have to let the nurse know when something is wrong. So you have to know your normals in order to determine if something is abnormal. And the majority of you have the correct answer. So for this one, the answer is A. The respiration rate in the scenario was 10. That means it is abnormal because it is below normal. The normal adult respiratory rate, the range is from 12 to 20 breaths per minute. Again, a rate of 10 is below normal and could indicate respiratory distress or other serious conditions. For example, post-op patient we just spoke of, they are still sedated from the anesthesia, but they complained of pain. Your nurse gave them medication such as morphine. Where morphine decreases, it suppresses the respiratory rate. They're not going to breathe as well because they're sedated. So, you as the CNA, when you're going in doing those vital signs and you see the respiratory rate is 10, stay in the room, call me in. That means that I'm probably going to be calling this doctor back saying, hey, I gave her too much. I gave her the prescribed dose, but this is too much medicine for her or him. And the doctor may have to adjust the medication. So see how we work together as a team to keep these patients safe. So you do your assessment as far as your vital signs, you report it to the nurse who comes in and does her assessment next. Question 17. What is the priority when caring for a resident who is actively vomiting? Is it A, offer them food, B, turn them to their side, C, leave them alone to rest, or D, provide a blanket? Someone is actively vomiting. Whoa. I can deal with a lot of bodily secretions. The one that I do not do well with is mucus. So if any of you all are interested in a respiratory therapist, my hat's off to you. I can deal with every other bodily fluid, but not any mucus. And so for this question, I think it's more so in line of maybe you're not in the medical bed, because if you're in the medical bed, we will raise the bed all the way up. But if the person's in a regular traditional bed, you're going to have to do B. You're going to turn them to the side because we need to protect their airway. So turning the vomiting patient to their side prevents aspiration of vomit into the lungs. But if they're in a medical bed, a bed that moves, also sitting them up all the way would do the same exact thing. In the chat, what is another word for vomit? Because we don't really put vomit in medical terms. We're not going to chart the patient vomiting. The person vomited. We're going to say they had 50 mLs of green. What's the other word? Yes, 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 Noah. Emesis. That is right. Oh, Noah was fast with that. All right, question 18. Diastolic blood pressure is determined by A, listening for the first clear sound, B, listening for the last clear sound, C, subtracting the lower number from the top, or D, adding the top and bottom numbers. So when you're doing the blood pressure the old-fashioned way, using a stethoscope and a sphygmomanometer, aka a blood pressure cuff, when you have the stethoscope on their brachial artery, what are you listening for in order to determine the diastolic blood pressure? Everybody has it. Yes, it is B. We're listening for the last clear sound. So the diastolic blood pressure is recorded when the last clear sound is heard as the cuff pressure is released. This sound indicates the point at which the heart is at rest. The systolic blood pressure, the top number, is the opposite. It is determined by the first sound heard when the blood begins to flow. And on that clinical skills video I referred to earlier, yes, we have a video that shows you not only how to read the gauge on the blood pressure cuff, but how to perform a blood pressure reading. Question 19. A patient with CHF or congestive heart failure may exhibit which of the following? A, weight loss, B, swelling in the abdominal cavity, C, increased urine output, D, swelling in the legs and feet. And I know you want to put C, but it's not C. It's C only after your nurse gave them a diuretic. And as soon as I say that, someone put C. So yes, they have increased urine output because they were swollen, and because of the edema, that's when they get the diuretic, and that's when they have increased urine output. But what's going to happen first is, because the heart is failing and the heart's not pumping, they're going to be retaining fluid. So CHF often causes fluid retention, leading to swelling in the legs and in the feet. And we notice that, we notify the doctor, who then orders the diuretic. And that's when they start diuresing and having a lot of urine output in order to get rid of all that fluid. Question 20. A diabetic patient with a fruity odor on their breath might have, is it A, hyperglycemia, B, hypoglycemia, C, kidney failure, or D, dehydration? And if you watch my video on Wednesday, we talked about diabetes. So someone has fruity breath. Are their sugars high or low? Oh, we're torn, but the majority of you say A, so let's see if you are right. And yes, you are. I mean, it's a telltale sign. Again, as a CNA, you don't diagnose. So what's going to happen? You're going to go into the room and it's going to smell as if their breath is going to smell as if they just got through chewing bubble gum, juicy fruit. And you're like, wow, did you just eat some fruit? And they're going to say no. And that should be like a sign, like, why does this person breath smell so fruity? Their blood sugars are high. So a fruity breath odor is a symptom of diabetic ketoacidosis, which is a serious complication of elevated hyperglycemia. Question 21. Which of the following best destroys all bacteria or medical instruments? Is it A, soaking in alcohol, B, washing with bleach, C, sterilizing, or D, scrubbing in hot water? All right, looks like we have someone who chose B. We have some C's. Let's see. What is the correct response going to be? And so 99% of you all chose C, and you're absolutely correct. That is sterilizing. And yes, they have sterilization techs. So if that's something you're interested in, counting medical equipment, making sure the physician gets the sterile equipment during the surgery, that is something you can look into after also. So the sterilization, that process destroys all forms of microbial life, including bacteria, viruses, and spores. It is the most effective method for ensuring an item is free from harmful microorganisms. Other methods like soaking in alcohol or washing with bleach are effective for reducing bacteria, but does not guarantee complete sterilization. Number 22. A resident complained of sudden sharp chest pain. Ouch! But it only happens when they breathe. What might they have? Is it A, pneumonia, B, apnea, C, bronchitis, or D, a pulmonary embolism? Sudden, sharp chest pain while breathing. So if they take a breath in, they feel this pain. Look, Sophia and Kristen and Qualzam. Yes, it is D. It is pulmonary embolism. So, sudden chest pain while breathing can indicate a PE, which is a medical emergency. Their oxygen saturations are going to drop. You're going to see everybody rushing into that room. And so, we can't really determine if someone has a PE by looking at them, but there are telltale signs such as the low oxygen level and the chest pain with breathing. And so, hey, BMAC, thank you so much. I passed both my exams. Congratulations. I did tell you can do it, and you did it. Congratulations. I think there's about 8 of you all now who've passed your test. All right, so proud of you. And next stop, nursing school or respiratory therapist school or physical therapy school. So you're just getting in, you do a good job, and then from there, tuition reimbursement. Let's see what those hospitals are going to let you achieve or help you achieve. Question 23. Safe use of oxygen therapy includes A, always setting the flow meter at 2 to 3 liters per minute. B, using caution with oxygen tubing so the client does not trip and or get it entangled in furniture. C, cleansing the nasal prongs each shift with alcohol. D, using wool blankets only to keep the patient warm. D has nothing to do with safe oxygen therapy, so it's not D. And that's right, Melanie. Next stop is LPN school, so you can do anything for a year. And then from there, they have the LPN RN bridge option. So this race is yours. Take as much time as you need, but I know that you're going to do great things. All right, so everybody, when someone has oxygen, they sometimes have long tubings. That can be a fall hazard. So the answer is going to be B. Oxygen therapy requires careful management to avoid accidents. The oxygen tubing should be arranged to avoid trips or entanglement, which could lead to injury or oxygen supply disruption. The flow rate of oxygen should always be as prescribed by the doctor, and nasal prongs should not be cleaned with alcohol. And of course, wool blankets, that was just a throw off that had nothing to do with it. And so CNAs cannot adjust oxygen flow. That is a nurse's duty, that is a respiratory therapist duty. So you can reconnect it though. If the tubing becomes disconnected from its source, you can reconnect it. You can make sure there's no kinks, but you cannot change the flow. If you do, you're stepping outside of your scope of practice and you can actually cause injury to your patient because for some patients, too much oxygen actually decreases their drive to breathe. 24. Which of the following is a symptom of a blood clot in the leg? That would be called a DVT or a deep vein thrombosis. So, what is a symptom of a blood clot in the leg? Is it A, red, swollen, and warm area? B, sudden itching? C, cold and pale skin? D, blister formation? I know my camera's off, but I'm smiling so big over here because you all have it. It is a blood clot in the leg, a DVT often causes redness, swelling, and warmth in the affected area. Tell me, as a CNA, what are you allowed to do? While you're waiting for that nurse to get into the room, should you massage the leg? What should you do? Should you get them up and take them for a walk? What are you going to do for this patient once you see that their leg is swollen, their calf is red? Are you just going to leave them in the bed? What do you think is best? Because they called you in the room because they had to use the bathroom. And they don't want to hear anything about waiting for me to come into the room. So what do you have to say to them? Are you going to massage the calf? Are you going to get them up and let them walk? Or are you going to keep them in that bed until the nurse gets there? Yes, yes. So Christine said elevate, and then Quasm said inform the nurse. Those are about the only two things you can do, and or keep them immobile. Don't do too much to that leg, because if you do, you can actually make the clot travel, and that is going to cause a worsening in their health condition. 25. The CNA observes a patient with abdominal distension, nausea, and no bowel movement for 5 days. Oh, Lord, that poor patient. The most appropriate action is to A, offer prune juice and wait 24 hours. B, encourage the patient to walk more. C, report the findings to the nurse immediately. D, document and continue care as usual. No bowel movement for 5 days. All right, let's go back. Let's go back. Thank you so much. I don't have a book for NHA, but NHA, I think it's NHAnow.com. They have their own books, Miss Phenomenal Woman. And tomorrow, I'm going to finish my book tomorrow. We're going to have two books coming out before the end of the year, but I'm going to finish the new book, and the new book is so much more detailed. But thank you for letting me know that it helped you. But NHA Now is where you go, and they have practice tests there for phlebotomy and whatever other certifications you're trying to get right now. I hope that helps you. And yes, everybody, it is C. So the signs are of possible impaction. So that means that's severe constipation or bowel obstruction. So that requires prompt nursing and possibly medical intervention. Look, we can't get all that impacted stool from out of their rectum, their colon. That person may have to go to surgery. So you never want your patients going longer than 2 or 3 days without a bowel movement. Get them up, see if the nurse will let you give them some prune juice. Question: prune juice is high in sugar and it's high in potassium. So, what two patient populations should not be given prune juice? Like, you just can't go in the fridge and be like, oh, that patient's constipated, let me give them prune juice, because you'll be making their situations worse. If it's high in sugar, who shouldn't get it? And it's high in potassium, so who else should not be receiving prune juice? Yes, Noah, as soon as that new book is available, I don't want you buying the old book, because the new book is going to be much, much better. And so it should be ready by Black Friday. I'm trying my best. Emilia says we cannot give a diabetic prune juice. You are right. The sugars are high. As a CNA, you don't give them anything without asking that nurse first, because yes, you're going to promote a bowel movement, but now their sugars are spiked up. All right. So who else, because of the high potassium? Who cannot excrete potassium? So prune juice has potassium. You have patients who shouldn't have potassium. What type of patients cannot have potassium? I know you know it. I know you know it. Pull it forth, team. So I think you're looking it up, and that's okay. I'm happy, because you may have a test that talks about different restrictions. And so, if a patient who has renal or kidney disease, because they can't excrete the potassium, if you give them prune juice that's full of potassium, you can actually start making their heart start beating irregularly. So, prune juice is high in potassium, and those who have renal or kidney failure cannot have potassium rich foods. Question 26. What is the CNA's role during a code blue emergency? Is it A, retrieve the crash cart and follow the nurse's instructions? B, call the doctor? C, charge the AED? D, administer oxygen? What is the CNA's role during a code blue emergency? All right, revealing the answer in 5, 4, 3, 2, and everybody got it right. Yes, it is A. We're going to send you out there. We're going to like, hey, go get that crash cart. So during the code blue, the CNA is part of the support team. CNAs do not independently provide advanced interventions like oxygen administration or AED operation. Those require licensed personnel. The CNA's safe and appropriate role is to quickly bring the needed equipment like the crash cart and assist the nurse or code team as directed. So usually during the code, you're compressions and you're the runner. Because as soon as that code team gets there, they're going to take over the compressions unless you're just a big, strong tech. They're going to take over the compressions, and that's when you go get the extra supplies, or we'll ask you to go check on the other patients if the code team is full of nurses and doctors, because someone still has to be out on the floor tending to the others. Question 27. What is code red commonly used for? Is it A, infant abduction, B, active shooter, C, hazardous spill, or D, fire or smoke? So code blue, code red. There are so many different codes. You'll learn those when you get through your facilities orientation. They'll talk about all their emergency procedures. But code red is for D. That's right. It's for fire and smoke. So code D typically indicates a fire or smoke in the facility. Question 28. What does code blue typically indicate? So we know you're going to go get the crash cart, but when someone says code blue, what does that mean? Is it A, a fire in the building, B, medical emergency requiring resuscitation, C, missing resident, or D, active shooter? And I've been seeing you, Kristen and Amelia Qualzum. You all have been getting so many of your answers correct. So very proud of you. That's right. Question 28. The answer is B. Code blue signals a medical emergency such as cardiac or respiratory arrest. And if you don't know how to do CPR, we do have a video on our main channel that is a CPR and AED review. It takes about 20 minutes. You'll learn how to save a life, plus you'll be prepared for your CPR exams if you have one coming up. 29. When performing perineal care on a male client, always A, clean the scrotum first, B, clean from front to back, C, hold the penis at a 90-degree angle, D, retract the foreskin if uncircumcised. Hey, Miss Phenomenal Woman, thank you so much. She's like, sorry to interrupt, get the book. You wait till the next book comes out. The next book is much better. So that was my first time writing a book. And so, being the nurse and learning how to do all this content creation and being an author, it can be a little challenging. So the next book is going to be better. But I thank you so much for just telling others about our resources. So whenever you have a male resident, you have to pull back that foreskin. It's going to be D. So retract the foreskin if I'm circumcised. So we're performing perineal care on a male client who is uncircumcised. It's important to retract the foreskin to clean underneath it, then gently return it to its normal position. This helps prevent infections such as Blantis. Also, always clean from front to back and hold the penis gently. But retracting the foreskin is essential for proper care. And this usually happens with the ladies. I've worked with a whole bunch of healthcare professionals. And so, ladies, whenever you see a man touching his private area, his genital area, sometimes you're like, oh, he's fresh. Have you ever thought that he's touching his area because he's dirty? So if you only focus on cleaning the penis and you don't clean his scrotum and you don't clean that area in between his scrotum and his rectal area, that area down there can be dirty. It can have old fecal matter. It can have yeast. So when in doubt, just ask, are you okay? Are you itching? Because not everyone's touching themselves to please themselves. These people are actually itching. And when women take antibiotics, sometimes they get a yeast infection. Well, guess what? Men take antibiotics too. And so they can get a yeast infection because that area is dark, it's moist, and it's susceptible to yeast growth. So give our men a little bit of grace and just, check on them. All right, question 31. And my screen went small. Let me figure this out. All right, so question 30. A resident on blood thinners accidentally cuts their hand. What is the first action? A, wash the wound with soap and water. B, apply pressure to stop the bleeding. C, notify the nurse immediately. D, cover the wound with a bandage. All right, we're torn between B's and C's. I mean, it's like half and half. It's equal. So I need for you to control the bleed. You can let me know while you're controlling the bleed, but you got to apply pressure. So if someone's bleeding, you got to control it. Just don't go and call the nurse and let them bleed out. So applying pressure helps control bleeding, which is critical in patients on blood thinners. Elaine passed her PCT exams. Congratulations, sweetheart. Question 31. Which is the most critical CNA action for a patient with aspiration precautions? A, feed the patient quickly to ensure they eat enough. B, assist the patient into a comfortable position. C, monitor for coughing or choking during meals. D, keep the patient in a wheelchair during the meals. Your patient is on aspiration precautions. What is the most critical action for a CNA? And I know a lot of you all are worried about comfort, but safety is more important than comfort because this patient, when they want to be comfort, they want to lay back and eat. They want to be semi-phallus. They want to be reclining. Absolutely not. So when someone has aspiration risk, it's not about their comfort. It's about you monitoring them because they could be very comfortable and aspirating. So sit them up. The answer is C. Monitoring for signs of aspiration, such as coughing, is going to be your role. Plus, it ensures prompt intervention if needed. Question number 32. A decubitus ulcer can be caused by all of the following except A, poor nutrition, B, pressure on the skin, C, poor circulation, or D, cotton clothing. Keyword there was except. All right, looks like Kristen and Enel have it. It is D. So cotton clothing, actually, that would probably help the patient because it's breathable. So, but everything else would be what would help prevent an ulcer. So decubitus ulcers are primarily caused by prolonged pressure on the skin, poor circulation, and inadequate nutrition, which affects the skin's ability to heal. Cotton clothing does not directly cause decubitus ulcers, although it could contribute to moisture accumulation, which could exacerbate skin breakdown. All right, so for this one, for when we talk about nutrition, what is something that a patient who has wounds, what must they eat in order to heal properly? Is it carbohydrates? What must they have? Because you're going to be in their feet in a patient who has wounds. And if all they want are the mashed potatoes and the cake, is that going to aid in their wound healing? What should they be eating besides carbohydrates? Yes, yes, yes. The answer is protein. Great job. And if they don't want to eat it, we can give them a supplement that has protein, but you have to tell me so I can get it ordered. Question 33. For a patient with a swallowing disorder, which food is safest to serve? A, pureed vegetables, B, sauteed vegetables, C, pasta, or D, room temperature water? And we're going all the way to 40. And some of you all have been here almost an hour with me studying. So I'm so proud of you. That is right. We're giving them A, pureed, not sauteed. So pureed vegetables. Pureed food reduces the risk of aspiration compared to thin liquids or solids. 34. Which vital sign requires immediate reporting to the nurse? Would it be A, a blood pressure of 126/78, B, a temperature of 98.6, C, a pulse of 48 beats per minute, or D, an oxygen saturation of 96%, which requires immediate reporting to the nurse? That's right. Looks like almost everybody has it right. And so I need for you to understand your vital signs. We have vital sign study guides that are free on our website. If you go to fltraining.com, scroll down, you're going to see study guides and more. Click on it. You're going to see a plethora of resources, but I need for you to understand your vital signs. The correct response is C, because a pulse that is less than 60 beats per minute could indicate cardiac problems and must be reported immediately. So for an adult heart rate or pulse, we expect the range to be 60 up to 100 beats per minute. And remember, the person's at rest, we expect those numbers to be closer to low normal versus if you just got someone up and walked them to the bathroom, where then we'd expect it to be high normal or a little bit above. So it depends on your patient's activity also. Question 35. A patient on droplet precaution should A, have their door to their room closed at all times, B, wear a mask if they leave the room, C, have no visitors, or D, be placed in a negative pressure room. So, droplet precautions, when they cough or they sneeze, the particles are heavy and they fall down. So, they're not really in the air as long as someone who would be on airborne precautions. So, that's your hint. If someone is on droplet precautions, which would be the correct response? So proud of you. It is B. Yes. Y'all make a nurse so proud. Okay, all right. So, patients on droplet precautions, such as those who have influenza, should wear a mask when leaving their room to prevent the spread of droplets. Remember, these are heavy, so they're going to cough, they're going to fall down. Negative pressure rooms are for airborne precautions because these are lightweight. They're going to be particles just floating into the air and into the hall. So, with negative pressure rooms, their air from their room goes outside, it does not go into the building. So airborne equals organisms that float in the air, such as tuberculosis, measles, and chickenpox, while droplets would be organisms that travel through larger respiratory droplets, such as the flu, RSV, or meningitis. Question 36. A resident is found on the floor conscious but holding their hip and crying in pain. What must the CNA do first? A, help them stand. B, quickly move them to the bed. C, leave them and find another CNA. D, call for the nurse and do not move them. So for everyone who left the patient who's on the floor crying, give me a different answer. You can't leave anyone who's in danger, who's on the floor crying. Reread that and give me a different answer because it is not C. You never leave anyone who's injured, especially if you're a medical professional. So the answer is going to be D. You're going to stay with them. You're going to call for that nurse. I'm happy that none of you chose A. Okay, so we're not going to stand them up. Residents who fall must not be moved because they could have hip and spinal injuries. We're going to move them as a team. Your nurse is going to be there. It's going to be a lot of us getting them up off the floor, and we're not going to have them stand. We can put a sheet, we can put something on the floor and help pick them up, get them into the bed so your nurse can complete his or her assessment. 37. A resident on fall precaution should have A, shoes with rubber soles, B, socks without grip, C, open toe sandals, or D, bare feet for better balance. And this is absolutely easy. So I expect 100% of you all to get this one correct. That is right. And if they don't have shoes or rubber soles, you're going to get them the gripper socks, the socks that have the little grips on the bottom. So the answer is A. Shoes with rubber soles help to prevent slipping and provide good traction. And I see you, Elaine. You've been doing a great job. Question 38. Before transferring a client from the bed to the wheelchair, the nurse aide should sit her on the edge of the bed for a few minutes to A, rearrange her gown or clothing, B, prevent orthostatic hypotension, C, position and secure the wheelchair, D, rest and remove the transfer belt. Why do we have the patient sit on the side of the bed before we stand them up or transfer them? We have a lot of A's, B's, and C's. So always think safety. Remember, it's not about comfort when you're taking this test. So it's not a, for most of these questions, safety is always first. Safety, safety, safety. And so the important thing is not rearranging her gown. The important thing is to sit her up so that her pressure doesn't drop when she stands up. And so the answer is going to be B. We're going to prevent orthostatic hypotension. You should have had that wheelchair near the bed and in place before you set them over the side of the bed. And so sit and recline on the edge of the bed before transferring to a wheelchair helps to prevent their blood pressure from dropping when they stand up, aka orthostatic hypotension. That could lead to dizziness or fainting. So allowing the clients to sit and adjust to the position change before standing gives their body time to stabilize. Question 39. What is the primary purpose of range of motion ROM exercises? Is it A, to prevent joint stiffness, B, to build muscle mass, C, to reduce the need for ambulation, or D, to improve circulation only? So when you're exercising your patient's arm, why are you performing those exercises? How does it benefit the resident or the patient? Sophie, you're doing so great. I mean, all of you are doing great. But yes, it is A. So it's not really about muscle building, because if you're just moving someone's wrist, that's not building muscles. But what is it doing? It is helping to prevent joint stiffness. And so if you're moving maybe larger muscles, then yes, that could prevent muscle atrophy. But remember, if these patients don't move it, they lose it. So try to get them to move about, and even something as simple as them combing their own hair or washing their own face, that requires them to move. And so that too can help prevent the stiffness in the joints. Question 40. What is the correct chest compression to breath ratio for adult CPR when one rescuer is present? So you're in someone's house, you're a home care caregiver, and the ambulance hasn't arrived yet, and they're in cardiac arrest. What is your ratio of compressions to breaths? Is it A, 5 compressions to 1 breath, B, 15 compressions to 2 breaths, C, 30 compressions to 2 breaths, or D, 100 compressions to 10 breaths? You have to know this because you're responsible for saving someone's life. So you have to know CPR. And I'm so proud of you because, like, every one of you all got the answer right. Yes, it is C. Woo! For adult CPR with 1 or 2 rescuers, the American Heart Association teaches a compression and ventilation ratio of 30 to 2. The goal is high quality compressions at a rate of 100 up to 120 compressions per minute with minimal interruptions. Y'all, I'm so proud of you. And as we say in each of our videos, remember that what you're doing right now, it matters so much because caring CNAs become caring nurses. So you're doing things the right way. You're learning. I know it's going to be tedious. You got to, right now you're starting at the bottom, but you're going to work your way to the top. And soon enough, you're going to be the nurse. You're going to be the doctor, because some of you all on the pre-med track, and being a CNA is a great way to achieve that also. So I need for you all to give yourself applause. Woo! You did it. You studied on a Friday night. I'm so proud of you. And if you haven't done so, please like the video, share it with a friend, share it with a fellow student. And if you haven't subscribed to our channel, please do so. And guess what? Thank you for watching. For our channel members, Scrubs and Ambition, and also our study buddies, I'll be uploading that new document for you all tomorrow. And so I thank you all. You're so welcome. Hi, do you have training for skills? Yes, Chitney. Just go to our YouTube channel, and whenever you click on the main channel page, you're going to see all the skills videos. We have a whole playlist for skills videos. So you all, your nurse is tired. I'm going to go to bed, but we did this, and I will see you all in the next video. Bye and have a good night.